Hi, this is part 4, and in this section we are going to go over the second part of the axial division for the skeletal system. The first bone that we are going to look at is the hyoid. It's on this cute convenient stand, and this is found underneath your mandible, and I will show you that on the skeleton in a second. But they look like baby fangs, and this provides for an attachment of the floor of the mouth. So this helps aiding in swallowing and movement of your tongue. And they look like little baby fangs. The sternum is your sternum, and there's 3 parts you need to know. Your manubrium is the top. This is your body of your sternum, and this is your xiphoid process of your sternum. And this sometimes, if people are doing CPR, this sometimes breaks off and can puncture a lung, which can cause some problems. So you got your manubrium of sternum, the body of the sternum, and then the xiphoid process of your sternum. Then we're going to talk about the vertebral column, and I'll show you the column in a minute, but there are 3 different major types of vertebrae. There's cervical vertebrae. You have 7 of those. There is thoracic vertebrae. You have 12 of those, and then you have 5 lumbar vertebrae. So one easy way to remember it is you have breakfast at 7, which are your cervical vertebrae. You have lunch at noon or 12, which are your thoracic vertebrae. And then you have dinner at 5, if you eat early, and that is you have your 5 lumbar vertebrae. So they do look a little different. Your cervical vertebrae have these little extra holes. This is called your spinal foramen, and I'll go over that again in a second. But they have these extra holes, and you have cervical nerves that go through those holes and some vessels that go through those holes, and only the cervical vertebrae have those extra holes. And they're numbered like C. If there's 7 cervical vertebrae, they're numbered C1, 2, 3, 4, 5, 6, 7. C1 is, you need to know the name of that, and that is your atlas. And it looks like this. It's really flat. All the cervical vertebrae are pretty flat. But this is your C1, this is your atlas. Your axis looks like this, and it has like a little finger on it. This is your C2, and your atlas and your axis kind of fit together. Okay, so you need to know specifically your atlas, which is your C1, and then your axis, which is your C2. And then you need to know the other cervicals. You just need to identify them as cervical vertebrae. Okay, your thoracic vertebrae look like this. Okay, they're a little bit longer. This is your spinous process, and if you look at the profile, it looks a lot like a giraffe. Now, like T1 and T12 don't necessarily look like giraffes, but like most of the middle ones look a lot like a giraffe head. Okay, so those are your thoracic vertebrae or thoracic vertebrae, and then these are your lumbar vertebrae. So your lumbar is the base. The further down the spine you go, the more bulkier the bone because it's holding more weight. And this is the lumbar, okay? And it looks like a moose head, sort of, okay? And then you've got your sacrum and your coccyx. So this is your sacrum and then your coccyx, and this makes up your tailbone. The coccyx is the very base. This breaks a lot of times. Sometimes if you like fall on the ice and it really hurts and there's nothing you can do, you can't put a cast on that at all. So that's your sacrum and then your coccyx. There's certain parts of the vertebrae you do need to know. You need to know the body of the vertebrae, which are these right here. So your discs, your cartilage discs would go in between those. Okay, so that's the body of the vertebrae. Your spinal foramen is the hole where your spinal cord goes. So if you're going to wear these as rings, that's where your fingers would go. So that's your spinal foramen. And then you've got some processes. You've got your transverse processes, which are transverse, I guess. They're kind of like the ears if we're making these into animals. Okay, and here's a transverse on a cervical. And then you have the spinous process, which are these right here. And that's the part of the back that sticks out. And then your spinous process. And a lot of the cervical, the spinous process has a little fork in it. Okay, and then when you're looking at the spinous process, it's always pointing downward, okay? So that way you can tell the top from the bottom, or the superior from the inferior. And you've got these notches. So the superior notch is on top and the inferior notch is on the bottom. So on the thoracic, here's your superior notch and here's your inferior notch. And that's how these bones fit together, okay? Superior notch and then inferior notch. The inferior notch is always larger too, okay? And then we've got some ribs we're gonna talk about. So here's the rib. There's different sizes and I'm gonna talk about those in a second. But if you look, the bumpy part is the part that would go into the vertebral column, okay? And the very end of it is the head. The skinnier part is the neck. And then the rib tubercle is this little bump right here. And that always goes into the vertebral column. And then there's different types of ribs. So really quick, I wanted to show you the hyoid bone, which is right here. See the hyoid? Ah, it's right there. It's really hidden. It's not the Adam's apple. Our Adam's apple is like cartilage, but it's way up in there. It's hard to see. So on your ribs, you've got here's your sternum, here's your manubrium, your body, and your xiphoid process, okay? And you've got your true ribs, which are right here. And then your false ribs are these 3 base ones on your rib cage. So there's 3 sets, okay? And those come together, they join together or collate together and then go to your sternum. And then you've got your floating ribs, which are the ones in the back, right here. Okay, so your true ribs are the ones that go right to the sternum. And then your false ribs are the ones that kind of join together and go to the sternum. And then your floating ones are the base ones. Okay, and that's all I got.